Hey everyone. Today I'd like to talk you through basically what a bulletproof backs method looks like for someone with sacroiliac joint pain. I'm sure many of you are aware of what that condition is. It affects a lot of people, and I just hope to share with you some simple ideas that you might want to try from the comfort of your own home to see if they can make a difference for you. I'm going to refer to a specific case because there's a bit more to it than the movement shifts. And this is what I often find. Chronic pain that's been there a while needs more than some movement advice. Often it needs a little bit of a challenge to how you think about your situation, a bit of a reframe, a bit of a reset. And from that space, people I find are then often more open to any of the movement advice I may have to offer. So this guy's name was Trevor. Trevor had the usual story, been to many people. Had lots of ideas that he had a structural leg length discrepancy and that was why he must, for the rest of his life, be in pain with his sacroiliac joint. Um, he'd been told that by a chiropractor when he was about 15. And so that had become his locked in story completely. I get it. I get how he would have totally come to that. So it made sense. So he had been revisiting that chiropractor for many years for short-term relief, but it obviously kept coming back, which kind of perpetuated his story that it would, and that he needed to keep seeing someone. Uh, he happened to come across my path purely because the chiropractor he'd been seeing for many years was unavailable that particular day, and he was in a lot more pain than normal. And I guess in that frustration, he was open and happy to see someone new. So we did. So we had a chat. I, as a practitioner, sensed he wasn't willing to look at his story. He didn't, so I didn't go there. I could hear it, but it wasn't the right time to challenge it. So yeah, we did an assessment. We looked at him. And what I observed is that when you looked at him standing front on, it truly did look like he had one leg longer than the other. But when I got him up on the table and did the leg length test, I saw that he was actually quite level between his legs. And that what we were observing in standing was simply a shift of his pelvis off center, creating the illusion from a frontal plane perspective that one leg was longer than the other. And if I can show you here, I don't think my video is going to extend to standing, but I'll show you in kneeling. Imagine my feet are here. I'm actually on my knees. This is his pelvis. He was literally standing over like this. His pelvis was off center. And if I felt his pelvis, then this hand was higher than this hand. And that's what he had been told was one leg longer than the other. So what I encouraged him to do was to simply place his pelvis evenly on his 2 feet, at which point we looked at these curves, we felt his pelvis, and he could see that, things were quite level. But what he reported was a hell of a lot of extra effort going in on this leg, the left leg, which made sense because he'd been getting around for many years with all of his weight shifted across to his right foot. So when we brought him back into centered positioning, he experienced the sense that he was leaning left. He felt like his left leg was doing a lot of work. When he looked in the mirror, he could see that wasn't true, but his body was telling him something different. And this is where we have to understand sensory inputs. Our feet are the biggest sensory drivers to our brain about where it is in space. Our eyes and ears contribute, but our feet provide more information to the brain than our eyes and ears combined. So when we're not tuning into that sensory input, for whatever reason, maybe it's really thick shoes, maybe it's that we never go barefoot, maybe it's just that we're dominant in our eyes and our ears, then the brain can have an altered sensory input which it adapts to. So his brain had adapted to thinking that being off to the right was centered. When I actually brought him into true center, the threshold in the left foot went sky high because now it had pressure that it hadn't had, and it perceived that it was falling left. And this makes sense. It was a pressure alteration which the brain perceived as falling left, when really, over time, it will regulate itself to understanding, this is actually where the middle is. When you have a pelvic shift, like Trevor, we're off to one side and we've been there a while, the sacroiliac joint on this side is compressed. It becomes hypomobile, meaning I won't move. The sacroiliac joint on this side becomes hypermobile, meaning it can move a lot. This one's open, this one's closed. Moving into this position gives them equal compression. This one decompresses, this one finds some stability. So watch that movement again. If I'm here, I simply go to here. And I retrain my feet that this is where the middle is. Now that sounds like such a simple concept, right? And if you have chronic sacroiliac issues, test out the theory, stand, notice if you're actually loading 2 feet equally or not. If you're not, then it could be a really important factor that will help you stabilize the joint integrity without having to do endless glute stabilization exercises or core stability drills. What I'm trying to teach you is how to move differently. Notice what your pattern is, do a different pattern, and notice what changes. But to my way of thinking, if Trevor is always going to move from that off-center position, he's always going to have pelvic lumbar sacral problems. If he can train his body to move from a centered position, then not only is he helping his sacroiliac joints, he's decreasing the hip pressure that would eventually lead to an arthritic hip. And all the things that go up the chain. Once he could see in his body something different, something that he could learn, something that was far easier to learn than 20 exercises on a sheet that were boring and he wasn't really interested in, all he had to do now was just notice when he was right and go back left. Easy. It was a conscious redirection of load through his feet. I encouraged him to tune into the sensory input from his feet, usually with his eyes closed so that he could really hear the sensory input from his feet louder, and to keep listening to the left leg about safety of adding new load to it. When Trevor put the weight back on that left leg, then he recalled a lot of chronic ankle sprains on the left foot as a youth. And I believe this was what was more of the issue for his ongoing sacroiliac problems than a leg length discrepancy. So these are interesting stories, these are interesting people, but they apply to so many of you out there, perhaps going about it in a far trickier way than you need to. Question what you see, question what you hear, ask, can this be simpler? Once Trevor had that experience in his body of feeling relief by simply moving left, it felt better on the right. That's all he needed. That was confirmation this was something useful. And then he was actually interested in challenging his own story. And we're all different. He's a kinesthetic learner. He needs to feel something and then his mind opens. Other people, they need to open something in their mind before they allow something in their body to open. And that's the beauty of who we are. That's the individual nature of who we are. But I just wanted to give you this introduction to my method. It's not a recipe. There's a hierarchy of concepts. I usually like to get people's minds aligned, open up their mind to some of the myths about back pain. I usually then like to have them emotionally free up a lot of stuff that may be suppressed or sitting in tissues that's not helping them. And then I like to look at their movement habits and patterns. But for some people, they're not willing to do the first two, they want the third first, and that's okay. That's where we start. If you like the idea, if you like the conversation, then please like, subscribe, and think about doing one of my courses. I have a book, which is for those that are intellectual and want the knowledge first. I have a 5-day back pain challenge, which is again more about the mental and emotional. Really good for those that have been in pain for a long time. And then I have a 6-week bells and whistles. It's all in there. Pathway to freedom for your back pain. I also have a practitioner course for physios like me, for any allied health practitioner that used to struggle with back pain clients, but who would like more tools, would like to know the bits they don't know, so that working in this space feels so much more effective and so much more fulfilling. That's the practitioner course. I'm about to record another one in this series. I'm going to look at discs and I'm going to look at facet joints. If anyone has any other diagnoses they'd like me to cover, then please just leave a comment below. Thanks for listening.